Thank you, Mr. Speaker. The MediClinic in Calgary was created as a pilot project in 2014 to provide trans and gender diverse youth in Calgary area with comprehensive health care and provides the care these youth need in order to live happy, healthy lives. Since its creation, wait list times have risen from 9 months to nearly 3 years. To the Associate Minister of Health, what are you doing to ensure that our youth have access to these invaluable services?
Honourable Associate Minister.
Thank you, Mr. Speaker, and to the member for this question. This past January, I had the opportunity to meet with the member, as well as Lindsay Peace and her son Ace. Ace came out as transgendered at the age of 14, and their family had made use of the medical services available at the MediClinic. As they shared their story, they described the clinic as a supportive and vital resource. And the clinic's mandate is to provide multidisciplinary assessment and consultation to transgendered youth in Calgary and in Southern Alberta, with specialists from psychiatry, adolescent medicine, endocrinology being brought together to find an allied and coordinated approach to care for transgendered youth.
Thank you, Honourable Minister. For supplemental.
Thank you, Mr. Speaker. Given that the wait times for the MediClinic continue to rise, and given that the continued operation of the clinic is essential to ensure trans and gender diverse youth are kept safe and healthy, to the same minister, what is the government doing to ensure that the MediClinic moves from a pilot program to a permanent program?
Associate Minister.
Thank you, Mr. Speaker. Our government is committed to the very critical services provided by the MediClinic. Since its opening, the MediClinic has seen more than 60 patients and has received over 200 referrals. We know these services save lives and that timely access is critical to youth, particularly as they approach puberty. I've asked AHS to bring forward options for improving access to these kinds of services, and we expect their recommendations on next steps to be brought forward later this spring. Outside of the clinic, we're also looking to expand service for transgender youth depending on their needs, including service through family physicians, endocrinologists, and mental health services.
Thank you, Honourable Minister. Second supplemental.
Given that many trans and gender diverse people have difficulty accessing health care due to transphobia and misinformation within the healthcare system, and given that trans and gender diverse individuals often need more medical attention in their lifetime than their cis counterparts, what is the minister doing to help educate doctors and nurses within the healthcare system about LGBTQ+ issues?
Associate Minister.
Thank you, Mr. Speaker, and to the member for the very important question. Albertans from the LGBTQ+ community deserve to have access to care in safe, inclusive, and respectful settings. Our government is working to make life better by including protection for transgender Albertans through changes to the Human Rights Act. Additionally, we're attending to this at every level, from the front line to policy. Alberta Health offers regular training for its staff on LGBTQ+ issues, and we're continually working for ways to be more inclusive and supportive, working with our partners such as the College of Physicians and Surgeons, who've recently launched new training programs in this area.
Thank you, Honourable Minister.